Okay, so what if a simple sore in your mouth, something you might just ignore for a few weeks, was actually the first clue in a serious life or death medical mystery? In this explainer, we're going to follow the doctors as they piece together this exact puzzle, starting with a wound that just won't heal, all the way to a life-threatening diagnosis and a plan to fight it. So let's meet our patient. This isn't just a case file, it's the story of Mr. R. He's a 58-year-old farmer from rural India, and his background? That's the crucial first clue. You see, in rural settings, health issues often show up late, which gives them more time to develop. That makes his case especially concerning right from the get-go. And here it is, the central mystery that brings him to the clinic. He's got a sore in his cheek that's been there for 4 months. 4 months. It's painful when he chews, and sometimes it even bleeds. Now, for doctors, any sore in your mouth that lasts more than 2 weeks is a major red flag. This one has been flashing like a neon sign for months. So how does a simple cheek sore turn into this whole life or death situation? Well, let's follow the medical team as they gather the evidence to solve this puzzle. The first step, as it always is a deep dive into the patient's history to hunt for any and all risk factors. And bam, right away, a massive clue emerges. Mr. R has been chewing Gutkha, which is a form of tobacco, for 20 years. 20 years. In India, this single habit is the #1 cause of oral cancers. When you combine that with poor nutrition and signs of anemia, well, it starts to paint a very clear and very worrying picture for the medical team. Now, to get a real, objective measure of his overall health, doctors use a scale called the ECOG performance status. Mr. R scores a 1. This is actually really good news. It means that even with his symptoms, he's still fully active and able to carry on with his daily life. And what that really tells the doctors is that he's strong enough to tolerate an aggressive treatment plan. Okay, so what happens next is the physical exam. And it's really interesting because you can think of it like investigators sweeping a crime scene. The investigation zeroes in on 2 key areas. First, the oral cavity, that's the primary site, the crime scene itself. And second, the neck, to see if the culprit has tried to escape. And inside his cheek, they find it. A large, hardened ulcer, measuring 4 by 3 centimeters. Now, that size alone is a huge red flag. Anything over 4 centimeters is automatically considered a more advanced stage, and it tells the team this is a serious tumor. And this right here is the next critical clue. In his neck, they find a firm, mobile lymph node. This is really strong evidence that the cancer is no longer just sitting in his cheek. It has likely started to travel through the lymphatic system. It's on the move. So, with the working diagnosis of cancer, the team launches a formal 3-step investigation. First step, a biopsy to get definitive proof. Second, a round of blood tests to make sure he's fit for the fight ahead. And third, a CT scan to basically map out the full extent of the invasion. The biopsy report comes back, and it's the DNA evidence they were waiting for. It confirms the identity of the culprit, well-differentiated squamous cell carcinoma. Now, squamous cell carcinoma is the most common type of oral cancer, and it's directly linked to tobacco use. The well-differentiated part means the cancer cells still look a lot like normal cells, which can sometimes point to a better prognosis. Now they know exactly what they're fighting. So, with all these clues in hand, how do doctors put it all together to see the big picture? They use a universal system called TNM staging. It's a way for doctors all over the world to speak the same language about cancer. The T stands for tumor size, the N for lymph node involvement, and the M for metastasis, which just means distance spread. So when you take all the clues from Mr. R's case and plug them into that TNM system, what do you get? Let's take a look. And here it is, the final verdict. Stage 3 oral cancer. That code T3N1M0 breaks it all down. T3 is for a large tumor, over 4 centimeters. N1 is for that single affected lymph node on the same side. And M0 means the CT scan confirmed the cancer has not spread to distant parts of the body. That's a huge piece of good news. So what does stage 3 actually mean for Mr. R? Well, here's the crucial point. Even though it's considered locally advanced, the disease is still contained to his head and neck. And because of that, the goal of treatment isn't just to manage the cancer. The goal is to cure it. So, what's the battle plan? It's a multifaceted attack. For cancers in the mouth, surgery is almost always the first and most important step, They'll go in, remove the tumor in his cheek, and clear out the lymph nodes in his neck. Then comes what's called adjuvant radiation therapy. Think of it as a cleanup crew sent in to hunt down any microscopic cancer cells that might have been left behind. Now, the big question is, do they add chemotherapy to the mix? That decision depends entirely on what the pathologist finds after surgery. If there are high-risk features, like cancer cells at the very edge of the removed tissue, or the cancer breaking out of a lymph node, then chemo is a must. For Mr. R, his report showed the margins were close, but there were no other high-risk features, so the team decided to proceed with just radiation therapy. But the treatment itself, it's a brutal battle. Radiation to the head and neck is incredibly tough. We're talking painful mouth sores, skin reactions, serious difficulty swallowing, and because of that, weight loss. These side effects have to be managed aggressively, because as we're about to see, staying on track is everything. And this is maybe the most critical takeaway from the entire treatment phase. This isn't an exaggeration, it is a fact backed by data. Any interruption, any delay in the radiation schedule, which is often caused by those severe side effects, it dramatically reduces the chances of a cure. And that's exactly why managing those side effects isn't just about comfort, it's a fundamental part of the cure itself. All that supportive care, from special mouthwashes to nutritional support, is what builds the bridge to get the patient to the other side of treatment. It ensures they can complete it without any of those deadly interruptions. And finally, we end on the single most powerful lesson from Mr. R's entire journey. Getting him to stop using tobacco isn't just about preventing a new cancer years from now. It is an active, essential part of his current therapy. Continuing to use tobacco during treatment can actually make the radiation less effective and hurts the body's ability to heal. So really, the most important prescription he receives is the one to quit for good.